Good day, ma'am. My name is Francine Tiltura, student nurse from the University of San Agustin. So, can you please state your name and your birthday?
My name is Olivia Sway, and I was born in December 11th.
Okay, how about your daughter's name, ma'am?
So this is my daughter Scarlett, and she's my 1-year-old child.
When is your birthday, ma'am?
May 13th.
Okay. So, today, ma'am, I will be performing a pediatric assessment. This is done to assess the clinical status of your daughter and to check if everything is going well. Is that okay with you?
Yeah.
Okay. Then we must provide privacy by closing all the doors and windows so that our client will feel comfortable during the duration of this procedure. Next is we prepare the required equipment and instrument. After that, we wear gloves to prevent cross-contamination. After that, we position the client appropriately. So, ma'am, I will borrow Scarlett and put her on the examination table. Thank you. Thank you. Hi, baby. And begin with the assessment. So, ma'am, I'll start first with the integumentary system, which is the skin. So, I will observe the color of the body, especially the tip of the nose, the external ear, then her lips, then her hands and feet. This is to check for cyanosis, which is bluish discoloration of the skin. Next is we observe for the lesions. Front and back. And I'll flip your baby, ma'am. Key. This. Key. Thank you. Next is we palpate the skin to determine the temperature and mobility by applying pressure with fingers and noting degree of indentation. Then check for mobility. Other side. Okay. Next is we inspect the quality, distribution, pattern of hair loss, if there is any on the scalp, then the texture and oiliness. Okay, for the quality of the hair of Scarlett is very fine. Then there is equal distribution of hair. Then there is also no are no bald spots that can be noted of, and then there is also no oiliness present. Then the amount of body hair is appropriate for her size. Next is we observe the symmetry of the frontal, parietal, and occipital prominences. So, upon observation, the frontal, parietal, and occipital prominences are symmetrical to each other. Next is we assess for the head control while the patient is in position, used for assessing the shape and symmetry. Then, with the head unsupported, observe the patient's ability to hold the head erect. Then we palpate the anterior fontanelle, so which is located here at the junction of the sagittal, coronal, and frontal sutures. Here. Then palpate the posterior fontanelle at the junction of the sagittal and lomboidal sutures. And then we assess for bulging pulsations and size. So to obtain accurate measurements, the client's baby, should not be crying because crying will produce a distorted or full bulging appearance. Next is we assess the suture lines. So we need to palpate the suture lines and check if these are open, united, or overlapping. So normal finding would be overlapping, especially if the baby is recently born. Then we assess the surface characteristics. So we palpate the scalp and it should feel soft. Next is we carry out vision screening, so the Snellen's test and the Allen's test. Since the infant is still young and we are using a teddy bear, I will be explaining what is a Snellen's test and an Allen's test. So a Snellen's test, video monitors showing letters or images, and the baby will identify it. While the Allen's test is where consists of 7 cards, with each card containing a single picture, and then this is where the baby or the child eyes are open and they are asked to name each picture. Then we do the uncover and cover test. This is where we cover one eye to check if there is any misalignment when the eye is occluded and check if it is the same with the other side. Next is we check the external anatomic structures. So we observe the upper eyelid for ptosis. This is where the drooping of the eyelid occurs. It really happens when there is a damaged nerve that controls the muscles of the eyelids. As you can see, there is none. Next is we check the eyes and eyelids for inflammation, crusting, edema, or any masses. Hello, baby. So upon checking, there is no inflammation, crusting, edema, or masses that can be noted of. Next is we inspect and palpate the lacrimal glands and sacs. So we need to check for any dryness or tearing that occurs because of the lack of release of fluid of the lacrimal glands, which cleanses and protects the eye surface. Next is we inspect the conjunctiva and sclera by instructing the client to look upward while you depress the lower lid with your thumb. So, baby Scarlett, please look up. Okay, upon checking, the conjunctiva sac is pink in color and then the sclera is white in color. Then we need to inspect the cornea, the lens, the pupils, and iris. After that, we test the pupillary response to light and reaction to accommodation in a dimly lit room. Other side. Okay, so the pupils are equally round, reactive to light, and accommodate. Next is we perform auditory testing. This is where we whisper something to the client, to the patient, and then check if they heard it correctly. So, apples. Okay. Then we inspect and palpate the ears. So we examine the external ear for placement, symmetry, and color. So the client's ears are symmetrical to each other. The color is normal. And then it is placed correctly on their body. Then we observe the auricle for discharges, swelling, and redness. So, okay, upon observation, there are no discharges, swelling, or redness. Then, next is we palpate for any lesions or tenderness by moving the auricle and pressing on the tragus and mastoid process. Do you feel any pain? Then next is we examine the ear canal for earwax, foreign bodies, discharges, scaliness, redness, or swelling. So, okay, upon checking, there is a presence of earwax, which is normal, and no presence of foreign bodies, discharges, redness, or swelling. Then we inspect the tympanic membrane. So the normal color of the tympanic membrane is pearly white. So upon inspection, the color that we should see is pearly white. So we need to pull the pinna down and back for checking the tympanic membrane. Can you hold the baby, ma'am? Thank you, ma'am. Okay, pulling the pinna down and back to check for the tympanic membrane. And other side. Okay. Color of the tympanic membrane is pearly white. So next is we inspect the nose. So I move the baby in an upright position so that I can inspect her nose easily. So first is we inspect the color of the mucosa, the color of and the consistency of the drainage, as well as presence of septal deviation or foreign body. Okay, baby. I'll just check your nose. Okay. So upon inspecting, the color of the mucosa is pale pink, and then there is no drainage present or septal deviation or any foreign body. Next is we moved on to the inspection of the mouth and the throat. So first is we observe the color of the lips, check for moisture, swelling, or lesions. And then we also observe if the lip edges meet. So assuming this is the mouth of the baby, I can note the color of the lips is color pink, which is healthy. It is also well moisturized, no swelling or lesions present, and then the lip edges meet. And then next is we instruct the baby or Scarlett to open her mouth with a tongue depressor and retract the buccal mucosa to note the color, hydration, or any inflammation or lesion. So, okay, say another side, So the color of the inner cheeks are pale pink, and then there is no inflammation or lesion present, as well as the baby is well hydrated. And the Stenson ducts are open at the rear of the mouth cavity. After that, we check for the teeth. So we count the number of upper and lower teeth, as well as observe for any discoloration, loose or missing teeth, dental caries, malocclusion, and malformation. So I can see that there are 2 upper teeth and 2 lower teeth, no teeth discoloration present, or also no loose teeth, no missing teeth also, no presence of dental caries, malocclusion, and malformation. Next is we observe the palate for continuity and shape. So upon checking, the color of the palette is light pink, is also smooth, and is movable. And then we move on with the neck inspection. So for the neck, we must observe if the neck is in midline while the patient or Scarlett is sitting upright. So the neck is in midline position. Then next is we palpate the thyroid gland. Do you feel any pain? Does it hurt? No? Okay. Next is we'll be palpating the lymph nodes. So, okay. Since it will not be clear where I will be palpating the lymph nodes, I will put up a picture of what of the places where it should be palpated. So we start palpating at the submental node, then the submandibular, next is the tonsillar, the anterior cervical, the posterior cervical, the supraclavicular, the preauricular, posterior auricular, and lastly is the occipital lymph nodes. So this is palpated to check if it is swollen or inflamed. Okay. Next is we inspect and palpate the breast. So, maybe we palpate this will be quicker. I will be checking your face. So, after we inspect, we palpate the breast. So next, we move on with the thorax and the lungs. So we inspect the shape of the thorax. So the normal finding should be smooth, rounded, and symmetrical. Next is the retraction. So we evaluate the intercostal muscles for signs of increased work of breathing. After evaluation, I can say that the baby is breathing normally. For the intercostal retraction, this occurs when the muscles between the ribs pull inward And this movement is often a sign of a person having a breathing problem. Upon assessing baby Scarlett, her ribs are moving outward, which is what it should look like. Next is we palpate for the tactile fremitus. For the tactile fremitus, since I cannot perform it on baby Scarlett, I will be explaining what it what it is about. Okay, so this is where you put your hands behind the back of your client, then ask them to say 99. Check if the patient has a healthy lungs. The tactile fremitus must be felt symmetrically along both sides of the chest. Next part of the assessment is doing an anterior, posterior, lateral percussion. So we will start with the anterior percussion. So, okay. Okay. Now for the posterior percussion. So, facing your back. Okay. This will be quick. Don't worry. Okay. Lastly is the lateral percussion. So we'll be checking here the side. Okay, and okay, other side. When percussing, resonant sound should be heard. These are low-pitched, hollow sounds that are heard over a normal lung. We'll be auscultating the posterior and lateral surfaces. Ready? And okay, ready? And go. Okay, other side. Mm-hmm. Next I'll be palpating the thrill and the peripheral pulses. Go. So next we auscultate for heart sounds. Dali po muna. lastly is the mitral. Okay. Next, we proceed with the abdomen. So we inspect the contour of the abdomen. Okay, so I will have the baby lie on her back. Then inspect the abdomen. So the abdomen is round and symmetrical to each side. And then after we inspect the contour of the abdomen, we observe for the abdominal skins for surface motion. There is no presence of peristaltic weight. Next is we auscultate the abdomen for bowel sounds. Okay, we will listen to the sound in your tongue. This will be very quick. So, we'll start with the right upper quadrant. This should take about 5 minutes. Then, the left upper quadrant. Then, the right lower quadrant. And the left lower quadrant. Okay, now it's done. Thank you. Okay, that was done. Next is we'll be palpating the 4 quadrants in the same manner. Then we move on to the female genitalia. So we inspect the sexual maturity rating. So using the Tanner stages, we assess the developmental stage of the pubic hair. So since this is still a baby, there is no pubic hair present on the baby. And then next is we inspect the mons pubis, vulva, perineum, and anus. So I'll be opening the legs of your baby now. Then inspect. For the male genitalia, we inspect also the sexual maturity rating using the Tanner stages and assess the developmental stage of the pubic hairs. For the penis, we note the appearance of the penis, if it is circumcised or not. Next is to note the position of the urethral meatus, and then evaluate the scrotal size and color, and note if the testes are seen in the scrotal sac. Next is to locate the testes within the scrotal sac. So we use our fingers in a milking motion to cause the testes to descend. And then note for the size, shape, and mobility of each testes. Then we move on to the anus. So as a rule, assessments are not performed on children unless you detect a problem or suspect an abuse. So during this assessment, I did not see any problem or suspect an abuse towards the patient, Scarlett. And there is no need for me to refer the children for further evaluation. Okay, that would be all, ma'am. Thank you very much for your time and cooperation, baby.